The cost of shutting down huge chunks of the economy is beginning to emerge. Manufacturing and services activity in the UK has contracted at the fastest pace on record. A member of the Bank of England Monetary Policy Committee said we could be looking at an economic contraction faster and deeper than anything we have seen for several centuries. The government announced it was going to ask for £180 billion more borrowing over the next 3 months, and some believe it'll go a lot higher than that.
If that lockdown is significantly extended and is, a hard lockdown, not just minor differences to our lives, then we'll be needing to raise significantly more money as tax revenues are even lower and spending is higher. So that could mean needing to raise up to £500 billion just this year. If that happens, then the private sector may be able to soak up most of that and then selling it on to the Bank of England via quantitative easing. But the Bank of England will need to think about going further if necessary to buy direct from the government.
Doesn't that amount to really printing money?
Yes, it's what people more often have meant by printing money. That doesn't mean that we shouldn't do it, but it does mean that we should be careful to do it well.
Talk like that has prompted Geert-Jan Vliege, member of the Bank of England Monetary Policy Committee, to say in a speech today, if we, the Bank of England, were the central bank of the Weimar Republic in 1920s Germany or Zimbabwe, the mechanical transactions on our balance sheet now would be similar to what is actually happening in the UK. The difference, he felt the need to point out, is that unlike Weimar Germany or Zimbabwe, our Central Bank Monetary Policy Committee is in charge of monetary policy with a legal mandate or duty to maintain price stability or low inflation. Testing for the virus is central to the government's strategy for pulling out of the economic tailspin. And today the Health Secretary announced a fleet of mobile testing labs will be sent out from these underused drive-in testing centres. It's hoped that will get the government up to the 100,000 tests a day it's promised to achieve a week today. The Health Secretary announced he was adding to the list of who can have the tests.
From today, employers of essential workers who will be able to go on gov.uk to get a test for any of their staff who need a test. And from tomorrow, any essential workers who need a test will be able to book an appointment on gov.uk themselves directly. This all applies for people in essential workers' households too who need a test. It's all part of getting Britain back on her feet.
That opens up the test to some 10 million people potentially. The government also announced 6 weeks after it abandoned track and tracing work, it's bringing it back.
How does it work?
An NHS app like Singapore's will log contacts through Bluetooth. It'll be backed up by a team of 18,000 people mapping who individuals with COVID-19 may have infected.
Test, track and trace done effectively, can help to suppress the transmission in a way that allows you then to have lesser social distancing rules.
Do you now think it was a wrong call for all the nations of the United Kingdom to stop track and trace?
These decisions were made on a sound basis. We'll all, when we get to a later stage in this, I'm sure we'll all look back and want to assess what we did, what we didn't do, so that we can learn for the future. But none of it...
Nicola Sturgeon was unveiling the Scottish Government's framework for decision-making on how controls could eventually be eased.
Talk of lifting the lockdown as if it's a flick of a switch moment is misguided.
The Scottish Government suggested the sort of easing of restrictions that could emerge included selected businesses being allowed to reopen, schools returning with staggered lessons in smaller classes to maintain social distancing, and there could be regional differences in the relaxation of rules.
And I'll no doubt see you again soon.
Nicola Sturgeon's announcements have often given a sneak preview of the UK government's next moves. The Health Secretary would only say today's measures announced in Downing Street might help the UK move to lighter restrictions in time.
Gary Gibbon, well, earlier I spoke to Scotland's First Minister Nicola Sturgeon, and I asked her what the key things to measure would be before Scotland moves to the next stage.
Well, firstly, and to put it very simply, we have to be more confident than we are right now that we've suppressed the virus to quite low levels at the moment. Now, At the start of lockdown, the best estimate was that that crucial reproduction number that everybody talks about, the R number, was above 3 in the UK. That means every person with the virus infected 3 more, each of them infected 3 more, and on and on and on, exponential growth. Our best estimate now is that that is perhaps between 0.6 and 1, and of course it's important to keep it below 1. But we're not absolutely confident about that. What gives us confidence is we see hospital admissions and ICU admissions reducing, but we need a bit more time to gather a bit more data to be confident that we've suppressed this virus to low levels.
Are the scientific experts you're listening to telling you that the likelihood is that after you start lifting lockdown, there will be an increase in infections and deaths? And perhaps not a peak, but a rise that could be a second plateau?
I don't think you need to be a scientist to know that that is the big risk. But yes, I mean, I think any scientific advice will tell you that as you have suppressed a virus through a severe lockdown, the virus doesn't go away when you do that, you just suppress it. So when you start to lift those restrictions, the risk is that it starts to transmit at a much faster rate again. And that's where we have to take care in how we do things.
Is test, trace, isolate the Scottish strategy or the UK strategy now, or both?
I'm First Minister of Scotland. I can only speak for the Scottish Government, but I think across the UK we're all grappling with the same things, and I think we're all probably heading in roughly the same direction. But it's not, it's not for me to speak for other governments. When you say, is it the Scottish strategy? It is part of the Scottish strategy. I think it would be simplistic to say there is one magic bullet here, and I don't think you would hear many scientists suggest that either, but it is a central part of what we need to do. But one of the difficult messages people like me have to get across to people is that we're going to have to find a new normal in all of this. So the ways in which we have all been used to living our lives forever are not necessarily going to return quickly. The other example I was talking about today was schools. We want to get kids back into schools as quickly as possible, but we might have to have classrooms that have desks further apart to have more social distancing. So maybe not all children will be able to be in school at the same time.
Are your experts telling you it's possible that the schools could go back before the summer holidays?
I couldn't say right now for certain that our schools will go back before summer. Remember, the Scottish summer holidays start earlier than the summer holidays in England, so that's perhaps more so for me than it would be elsewhere in the UK. But I don't want children to be out of school for a day longer than is necessary. So there may be points in between where some children, some examples that have been talked about, and don't take this as a decision, these are things we're thinking through, that you have classes split into two, where one half is in school certain days, the other half in other days, to reduce the number of children that are in classes at any one time.
Yeah.
These are the kind of creative things we're going to have to think about if we are to get a semblance of normality back, but still do what we have to do in suppressing this virus and stop it doing the horrendous damage that we've seen it do in recent weeks.
Could the holidays be cancelled? Could schools be brought back during what would normally be the holiday time to make up?
All of these things are, I guess, theoretically possible, because I think given the uncertainties and the difficult challenges we're grappling with just now, to categorically rule anything out would be as wrong as categorically ruling anything in.
To come back to this test, trace, isolate strategy, in order to start lifting the restrictions, you need to have the capacity of testing and tracing.
Yeah.
So at what level of testing and tracing do you need to be for people to start not being locked down anymore?
Okay, so we will need to do that progressively over the period as, you're right, we think about lifting these restrictions. Now, again, what I'm going to do here is talk you through the process of work that is already underway in the Scottish Government around this, because it's not yet at a state where I can give you definitive answers about how many, when. So we need to, and this is what we are doing, we need to assess the scale of what we need. That is, to some extent, dependent on where we think the prevalence of the virus will be, how many people are likely to be symptomatic, how many tests would that require. That work is underway in the Scottish Government.
But what's really interesting is that within the UK, the nations aren't doing things very differently. You've basically sort of done what everybody else did. Do you think that was right?
We've taken the best decisions based on the best advice with the best judgment we could. There's nothing easier at a time like this, and it's part of democracy. I'm not criticising it, to apply 2020 hindsight and say you would have done things differently. We will get to a point where we will all want to look back and say, did we do things right? Did we get things wrong? We'll all have got things wrong and learn from that. But in terms of the importance
But you could have done what Ireland did, and instead you did what London did.
Well, I did the best thing that I thought was right for Scotland. And the point I was going to make, and if you talk to people in Northern Ireland, they're very conscious of this in terms of the island of Ireland context. This virus doesn't respect borders or boundaries. It's not
Right, but as it's turned out, if you take a country like Ireland that's had a lower death rate, you may well, with the benefit of hindsight, look back and say, we should have done what they did rather than following the expertise in Westminster.
Well, with Ireland, I mean, you can make all sorts of comparisons, and I'll come on and say a bit more about that. I'm not convinced that there's that much difference between what Scotland, the UK did and what Ireland did in reality and in substance. But we, of course, will all want to look back.
But one of the biggest decisions, as you know, was on March the 12th, when it was announced that you were switching, to end community testing, basically. And that it's widely now regarded as set us back quite a long way in terms of our ability to get community testing back up and running. Why did you go along with that strategy of stopping testing in the community?
Well, let me explain the decision-making, but can I just challenge your language here? I didn't go along with anything. I made judgments of my own. I'm capable of doing that based on the best advice. Along this way, I've established...
OK, well, why did you decide to do that?
Well, let me explain that. But I would so a couple of points I would challenge you. Firstly, that everybody thinks that was a mistake. Some people do. There are other views in that, and that reflects the fact that we're all learning here as we go. I don't agree it's set back test, trace, isolate, because we have been building up since then our testing capacity from a much, much smaller base. But we went into, there was an action plan set out before that by all 4 nations signed up to that set out the phases we would go through, contain and delay being the first 2. We moved to delay at a point when it was thought community transmission had gathered pace that was the right thing to do. But here's I think the key point. At that point we were telling people with symptoms to isolate. Now, if we'd been testing everybody, we would have been telling people that tested positive to isolate. So actually, there was no difference in what we were doing to manage the virus.
No, but there was a massive difference in our knowledge of how far the infection had gone. And that's what we're now trying to catch up with. And you must have known, because I'm sure you would have seen what South Korea had done, what Germany was doing, that have very different approaches of really maintaining testing throughout. And you decided to do something quite different. And that's what I'm wanting to know.
To be frank, I am not sure that would have made a huge difference, and it will be absolutely essential at a point for us to look back, learn the lessons, and inevitably all of us will have. I'll have made mistakes so far. Everybody will make more in the future.
And just finally, we now know that Donald Trump's staff in Scotland are being furloughed. And so taxpayers' money, Scottish taxpayers' money, will be going to pay the bills that might have been picked up by the president's business. Do you think that's an appropriate use of taxpayers' money?
I've been clear previously, so I'll be clear here again now, and this is a general comment, and you can take it however you want in relation to the president's businesses here. It's right that governments give unprecedented support to businesses when we're asking businesses to do unprecedented things, but businesses should think carefully about whether they need that support, so that as much of the support as possible is going to those who really need it. So if a business has got deep pockets of its own, it should be relying on them before the taxpayer.
First Minister, thank you very much for your time.
Thank you.
Thanks a lot.
Thanks.
We shall have more on Nicola Sturgeon's announcement in a moment from our Scotland correspondent Kieran Jenkins. But first, let's look more deeply at those frightening economic warnings with our business and global trade correspondent Paul McNamara. Paul, just how bad are things going to get?
Well, here's an indicator of how bad things already are. This should be full of people having a drink after work, not just them. This is the bar from TV's First Dates, back when people used to be able to go for dates and meet face to face. Instead, well, it's just me and a cameraman. One senior Bank of England policymaker said today, we're looking at pretty much the worst recession ever. That warning came with one of the most closely watched business surveys, the PMIs. This is essentially businesses saying what they're experiencing when it comes to output. Look at this graph of their results. So 2008, global financial crisis, biggest hit they've ever had. Climbs back up, bobbles around an average. Then comes coronavirus. The plunge we're in at the moment, this isn't just record lows. This is lower than anyone ever thought imaginable. Now look, every other day data comes out saying just how bad this is. It almost becomes meaningless. Here's the meaning. Firstly, unemployment. The response from that survey, the findings of it, quote, job losses on an unprecedented scale, even if furloughed workers were excluded. Secondly, that high unemployment really matters when it comes to long-term recovery. All the predictions at the moment work on a sharp decrease in output and a sharp increase. The investors we're talking to today say those predictions don't hold water anymore. We're looking at a really slow recovery. And one industry particularly worried about that slow recovery is hospitality. Just yesterday, the government's saying that bars might have to change how they operate up until Christmas. We spoke to the head of UK hospitality today. She said without more government help, lots of those bars might not make it until after Christmas.
We'll need to have an extended furlough scheme to allow us to furlough staff that are not needed and protect those jobs, retain those jobs. And you'll also need action on rents. And put simply, if we don't get that level of support from government, then 2 million jobs and half of all hospitality businesses will be at risk and we're too big to fail.
So more help needed, that's more money, that's more debt, because debt is how the Treasury is paying for all the help. This morning, we got an indicator as to what the level of debt is. OK, so at the budget, just 6 weeks ago, the government was planning to borrow $156 billion for the whole year. So far, they've borrowed $45 billion in just a month. Today announced they want to raise another $180 billion in the next 3 months. That puts us at £225 billion with 2/3 of the financial year still to go. What we're talking about now is debt that our children and our children's children will be paying off. Now, look, businesses across the nation are having a really hard time. We at Channel 4 News, we want to hear from them. We want them to get in touch with us at frontlinestories@itn.co.uk, and we want to start telling their stories.
Paul McNamara. Now let's hear from our Scotland correspondent, Kieran Jenkins, who is in Glasgow. Kieran, what are we to make of what Nicola Sturgeon has been saying about lifting the lockdown in Scotland?
John, yeah, it was never billed as an exit plan from Nicola Sturgeon. It was a plan to talk about an exit plan. And central to it, just as we're hearing in England now, is testing and tracing. Now, all along, the World Health Organization has said that countries should continue testing and tracing throughout this pandemic. But as we know, in the UK, it stopped, and in Scotland, it stopped before a single death from COVID-19 was confirmed. So as you heard from the First Minister, what we don't have from the Scottish Government yet are details exactly of what capacity is required or in place to test and trace again. Now, another question is around care homes, where there have been so many deaths in Scotland and across the UK. If we're going to talk about any sort of easing of restrictions, today's document from the Scottish Government says they still need a better understanding of transmission in care homes. So yes, Nicola Sturgeon has gone further on some levels than her UK counterparts, and she's been frank about the fact that restrictions are the new normal now. But as part of this grown-up conversation that she's advocating, she is being asked tonight for greater clarity and detail.
And Kieran, we're hearing today that Donald Trump's Scottish business might be furloughing its staff.
Yes, well, Donald Trump's businesses are now run day-to-day by his sons, and the Trump Organisation's 2 loss-making golf courses in Scotland were, of course, gearing up for the summer season like so many other businesses, but unlike other businesses, they have this unique connection to the billionaire US president. Those golf courses are effectively mothballed now, and the bartenders and gardeners and caddies who work there are facing the same pressures as many other workers across the UK. So the Trump organisation can make a claim to the government on behalf of their employees for 80% of their wages from public funds. And tonight, Eric Trump, the president's son, confirmed as much. He told us that the job retention plan created by the UK government has nothing to do with the Trump organisation and does not benefit the business. It's solely about protecting people and their families who would otherwise be out of work.
Kieran Jenkins.
Kieran Jenkins in Scotland.
Now, staying with the issue of furloughed workers, the Business Secretary today revealed that 2.8 million workers have been furloughed under the government support scheme, where it pays 80% of their wages. But hundreds of thousands of people could be falling through gaps in the scheme. Our social affairs editor, Jackie Long, has been speaking to some who are finding themselves without an income for the first time, unable to afford bills or even pay for food.
In homes across the country, this pandemic is carving out a new, terrible reality for millions of people.
It just destroyed us. It took my income away. It took everything that I'd worked hard for. I've never been unemployed. I've always worked from the age of 14. Even when I was at school, I had a Saturday job. And so for the first time, I faced not only having no income, but being unemployed, claiming benefits and having my identity taken, basically.
Laura Goff started a new job in March working with vulnerable adults.
Don't be scared.
She missed being eligible for the government's furlough scheme by days.
I don't know if at the end of this month whether I'm going to be able to buy a loaf of bread or a bottle of milk or some eggs just to eat.
All of my contracts, which I had contracts with schools, big maintenance companies, it's just gone completely dead. I've had 6-7 months worth of work cancelled, so I've literally got nothing coming in whatsoever. Been looking at delivering jobs,
fruit picking jobs,
literally anything I can get my hands on. I'm trying to do, but there's just nothing out there for me to do at the moment, and it's getting really stressful now.
Well, how much longer can you survive at the moment, where you are at the moment financially?
Another month or so, maybe.
Probably not even a month.
They say universal credit won't even cover the rent. They're relying on Laura's mum. A heavy burden all round.
My mum has taken extra shifts to try and make sure that there's money for me put aside.
What do you make of the fact that your mum, who is already working with COVID patients, is taking more shifts to help you out or to make sure that you'll be all right?
It terrifies me. I feel very responsible. My mum's trying to make sure that I can eat. And as a 31-year-old woman expecting your parents to do that's very humbling. But then to know that she's going directly into the line of fire is really, really hard, and I don't want her doing that.
At the Food Bank Distribution Centre in Cannock, across the county border in Staffordshire, there is a new reality too.
Before the coronavirus outbreak, we had 21 tonnes of food in stock. Now we're closer to sort of like 8 or 9 tonnes of food. We're having to buy food for the first time. Normally we rely entirely on donations.
Demand has risen by more than 300% on the same period last year, fuelled by people thrown into crisis by the coronavirus.
Big thing has been those people who've been working, so people who wouldn't have typically ever seen themselves using a food bank, suddenly they're having to use it for the first time ever. That's a lot of people who are unemployed, unexpectedly unemployed. You've got people who've been self-employed and they're awaiting for some of the help that is available, but there's a time element to that. But at the moment they have nothing and they still have bills to pay.
As long as I am physically able to work, I will work.
Being stood down from work was hard enough for former serviceman Mark Harrison. But as the father of 2 young children, finding out he couldn't be furloughed was even harder. He'd started a new job in early March and missed out by a matter of days. He says the stress has been overwhelming.
Well, I probably haven't slept for about 2, maybe 3 weeks properly. Constantly not going to sleep, waking up, just worrying about the level of stress that I've got, because I have to hide it from my children so they don't see me in that state. So at night time, when it's just me and my partner, I will lay there wide awake, just worrying about how long is it going to last. I served my nation. I served my country for 13 years. Proudly did it. And I would probably do it again. But you look at it and go, well, what's the point? There's no support, and we can fall through gaps so easily. For a little tiny tweak in the rules that's needed, we end up with nothing.
Some stability. He says they're now trying to survive on his partner's salary, around £900 a month.
She's frontline. She works on ICU on one of the local hospitals, so she is in direct contact with the COVID patients. She sees it firsthand. She does 12.5-hour shifts, nights, days, whatever is needed. She is frontline.
For people like Mark, the government say there are other options, like universal credit. And what are they saying about what you might be entitled to?
Nothing, to put it blunt. Entitled to nothing. For far as universal credit portal, like I said, I may have filled it in incorrectly. It was completely confusing and new to me because I've never done it before. They've said I'm entitled to nothing.
The government say they've spent billions offering support and that there always had to be a cut-off for the furlough system to avoid fraud.
I would completely disagree. For the simple fact they were able to tax me in March, take my national insurance and tax. They did the same in February. I have a P45, I have a P60, I have all the evidence that I need to demonstrate that I've paid into the system. He was
like millions of others, they live in hope of getting back to work. Right now, they're focusing on how they'll manage until that happens.